Welcome back.
Moving on to drugs. Drugs. You know, I said I classify into food items, drugs, and lifestyle. Moving on to drugs. Of course, it's no more news if you have been following my videos that the class of drugs called NSAIDs, which are drugs mainly used to manage pain, is a no-no. We have said that the drugs in themselves, if used frequently or for a prolonged period of time or on empty stomachs, can themselves cause stomach ulcer. How much more if you, who already has a stomach ulcer, now use them? Examples of these drugs include ibuprofen. You know, sometimes I'll ask patients, do you take ibuprofen? They'll say no. But they bring out a drug and say they are taking that drug. And when you see, that drug is actually ibuprofen. So, what's the point here? It can come in different brand names. Let's just say as a rule of thumb, if you have any analgesic, any pain relieving drug that has Ofin in them, Fin, or Ibu, Mr. Ibu. If you see Mr. Ibu or Ofin in any of your pain relieving drugs, please avoid them. So they have different brand names. In this part of the world, you see things like ibuprofen, Ibucap, Ibupress, and so on and so forth. Another example of the drugs that you should avoid is diclofenac. Like we said, it may not come as diclofenac, but any drug you see NAC in them, it can come as Lovnac or different brand names, what have you. Another example is piroxicam. A popular brand of that is Felvin. Ladies, you know what to do with Felvin.
If you didn't do it, tell me you didn't do it. I didn't do it.
It's not from my mouth that they will hear that soldier's wife has died.
You keep quiet.
Naproxen is another example. Naproxen. I must mention aspirin. A popular brand in Nigeria is Vasoprene. Vasoprene is commonly used as a blood thinner to prevent blood clotting in some patients with comorbidities or conditions that predispose them to having blood clot in their system, such as hypertension, diabetes, stroke, people who have had a heart attack, angina, chest pain, a heart attack, and so on. Okay, having said that, if you have a stomach ulcer, aspirin is a no-no. So if you have a stomach ulcer and you need to take a blood thinner, please see your doctor for an alternative.
Okay.
An alternative we use is clopidogrel. If you have ulcer and you need to take an analgesic stronger than paracetamol for a pain or an ache condition, you can use celecoxib. That is the only drug in that class of drug called NSAIDs that I'm aware of that does not have the side effects of causing stomach ulcer. Ask your doctor for a prescription for them. Before you argue with your doctor, if you have ulcer and he prescribes Atrotec, I don't want to cause kata, okay? You may discover, if you read the pamphlet or the carton of your drug, Atrotec, that it has diclofenac in it.
True.
And so you may wonder that if it has diclofenac in it, and we have said that ulcer patient should not use diclofenac, why then is my doctor giving me Atrotec? Don't think that your doctor does not know book. In fact, he knows book. Naim Sabi pass. Atrotec truly has diclofenac in it. But if you check very well, you will see that it has been combined with another drug. That other drug is what we modify the diclofenac in such a way that it will not manifest the usual side effect of causing ulcers in your stomach. If you're going to be using Atrotec, let the prescription come from your doctor. You get why?
What?
I'm sure if you get to pharmacy stores, the standard ones, they would not even sell Atrotec to you without a prescription. Before I conclude on drugs, needful to mention that you should also avoid a high dose of vitamin C.
Oh, really?
Vitamin C is actually ascorbic acid.
Wow.
Did you hear acid?
No.
Yes.
And finally, to lifestyle. We've talked about food items, we've talked about drugs, and now to lifestyle. Reduce or avoid totally alcohol consumption.
Something will kill a man.
Reduce or quit smoking. Smoking increases the risk of relapse of stomach ulcer. Do not be in the habits of eating too hot or too cold food. Reduce your stress level. You will remember that I said in the video talking about what causes stomach ulcer, that stress is a known cause of stomach ulcers.
Oh,
Stress
yeah.
reduces ulcers. Manage stress. Avoid fasting. For the time being, we are waiting for this ulcer to be cured. As a matter of fact, what we encourage is small but frequent meals. You eat frequently, say every 4 to 6 hours, or make it small quantity. When you do that, you will get busy at every time the acid in your stomach.
I see.
So when you get it busy, it won't have time for your wound.
Yes.
And the wound will just keep healing without it knowing.
Wow.
It will just be healing. You have given it work to do. So as it's busy with digesting the food items you keep supplying on a frequent note, it will not have time for your wound. And so your wound will heal. While you are treating your ulcer and waiting for it to heal up, it's important that you use antacid to neutralize acid on occasions of stomach pain. So intermittent use of antacid might be helpful to neutralize acid on occasion of your stomach pain. I will talk about food to avoid in peptic ulcer. I think it's also just fair to talk about food items that we encourage that can aid the healing of your stomach ulcers. So expect a video on what to eat and how to eat a peptic ulcer disease. If you think this information has been helpful to you, then don't keep it to yourself. Share this video to anyone you think might benefit from it. Help like this video as well, because the more they likes, the more YouTube algorithm helps suggest this video to people, and that way I'll be able to help more people. Subscribe if you haven't. See ya, catch ya later.